So this is spina bifida. So what is spina bifida? It's a congenital problem, and it's a defect in the neural tube, uh, and it can be a lot of different things. But basically, it's when the vertebral arch, when the uh, when the part above the pedicles of the spine fail to close over the spinal cord and form that arch that protects it. So the lamina and the spinous processes from transverse process to transverse process, and it can be really subtle and just an incidental finding on X-rays, or it can be very very severe. Um, it's 1 in 1,000 happen. Uh, so yeah, it's uh, it's actually quite a high etiology. I've seen lots of them in practice in X-rays. 99% of them have been very mild and just incidental findings. So this is a congenital problem, and it happens really early in gestation. This is when the neural tube is forming. So day 14 to 28. So basically 2 weeks and to a month to 4 weeks after conception. So this is very, very early. Most of the time, uh, mothers don't even know they're pregnant as this neural tube is forming. Um, so And what causes it is really folic acid um, deficiencies. And it's one of the reasons why they have people that are contemplating pregnancy to take folic acid supplements. Uh, that's decreased the daily consumption of folic acid has decreased the incidence of spina bifida greatly in North America. Um, it uh, it seems to be very much linked to this prenatal health of the mother. So, uh, with what we know now compared to what used to happen and what happens still in the third world countries, um, we've decreased this quite a bit. So it's congenital, but it's not genetic necessarily. It's a problem in the development. So the mildest form is called spina bifida occulta. Occulta means hidden. Anything that's occult is hidden. So in spina bifida occulta, the vertebral arch basically doesn't close over. It the two halves of the lamina don't meet. Um, Now, there may be nothing other than X-rays that show it. It is very common. Uh, Sometimes you'll see a little tuft of hair growing and maybe a little dimple if there's no spinous process at the spot. Um, Oftentimes you'll find it in just palpation as you're trying to count uh, vertebrae. It happens. Most often happens in the lumbar spine. Now, the only time this can be dangerous is if the cord itself gets tethered, to kind of tangled up, or scar tissue adheres it to this defect. Um, but really, it's a pretty mild, not that important finding. Um, but it can get worse. So uh, sometimes what happens is the meninges will balloon out uh, at the area of the defect, and so the dura mater will fill with cerebral spinal fluid and actually start to push out. Uh, Along with the arachnoid, it pulls the arachnoid with it, and it basically becomes like a cyst. or a seal. Seal means fluid-filled sac. So meningeal seal is so spina in the spine, bifid, 2 points, meninges filling up with fluid and forming a cyst. Um, as long as the spinal cord's not involved, it can be repaired surgically, and it's not that big a deal. Um, Fortunately, it is a fairly rare thing. Uh, the more severe form uh, is this spina bifida myelomeningeal seal. It says most common, but it's the most common serious form. Uh, uh, what this is saying, so this is not occulta. Of spina bifida meningeal seal or myelomeningeal seal, 94% of them are myelome. So myelome means that the spinal cord protrudes through along with the meninges. Usually it's the cauda equina because it happens low. Um, so this can be quite severe. This can be a real kind of teratoma. It's a real kind of monster thing. The skin may not even cover the cleft, so that the spinal cord and the cauda equina are literally exposed to the outside, and so it can be real bad problem of infection into the central nervous system, like a meningitis or an encephalitis sort of thing. If it's occulta, there's probably not even going to be any signs and symptoms. If it's cystic and it's obvious, then it can be really a big problem. Now, if you remember that the cerebral spinal fluid, which is made in the ventricles of the brain, passes down through the center of the spinal cord, and then at the cauda equina comes up on the outside in the subdural space, or sorry, in the subarachnoid space. What'll happen is this flow of cerebral spinal fluid will get interrupted and disturbed. So it leads to other cerebral spinal fluid issues. So it's hydrocephalus is the big thing, because the fluid starts to build up on the brain, especially if what happens is the spinal cord itself kind of gets kinked and the spinal fluid can't drain properly. And then those people have to be treated with a shunt, something that's going to take the pressure off the brain. You can have some cognitive impairment if this pressure stops proper brain development. A lot of times this has comorbidity with severe scoliosis, some muscular imbalances. You can imagine that the neurology to skeletal muscle will get impaired by this. It can be a real problem. These people are often wheelchair bound, so they have problems with pressure ulcers and maybe infections. They might have problems with urination, again, neurological issues, GI problems and GI motility problems, etc. So this one is just the meningeal seal. This is a bigger meningeal seal, and the cauda equina is pulled out into that. This is the myelomeningeal seal. So we're getting much better at detecting them prenatally. It's one of the reasons that we do ultrasounds. Sometimes they're surgically corrected in utero, just because what they don't want to do is have improper neurological development. So the earlier you can intervene, the better. Most of the time it's done within a couple of days of birth, and then they do physiotherapy to rehabilitate the muscles that are involved. Assistive equipment might be things like a wheelchair. Um, if there's they might have to deal with the comorbidities, the scoliosis with bracing and Harrington rods, shunts for hydrocephalus, surgeries to release scarring, if the cord's tethered, those kinds of things are all dealt with usually shortly after birth. Um, so if this is a spina bifida occulta, don't worry about it. You can massage normally. If it's anything beyond that, you have to assess the person's function, their sensation or lack of sensation, uh, and that kind of thing. It Massage can fit nicely into a team approach to the care and maintenance of these people, just like anybody who's wheelchair bound.